What can you do if you have bunion pain? We get this question fairly often here at Physical Therapy for Everybody, and people are looking for ideas that are safe for them to implement or to try before they consider having surgery. A lot of people who come in here who have bunions have been diagnosed by a podiatrist. Usually they have been recommended for surgery to deal with those. And they either make their way in here because they're looking for some tips and strategies to deal with the pain right now, or they're looking for ways to be able to avoid surgery. So today what we're going to talk about is all of our best tips and strategies to help deal with bunion pain and help you avoid surgery. I'm Dr. Amy with Physical Therapy for Everybody, and here we are focused on keeping people active, healthy, and confident in their lifestyle so that they can do the things they want without having to do medication or surgery. And I've just got to tell you guys, I tell this to everybody who comes in here. If you're talking about surgery for your foot or for your hand specifically, I really discourage you from doing that, or at least I encourage you to try some other techniques first to see if they'll work for you. The foot and the hand in particular are very intricate because there's so many bones, there's so many joints, there's so many ligaments and tendons and muscles. There's so many things and it's so intricate in there. And most of the time when I see somebody have to have a surgery on their foot or hand, it's the first surgery of many to come, because usually the surgery doesn't last more than 5 to 10 years, and then they're going on to the next one. And it may be a progression of the issue in the first place, it may be a replacement of what happened in the first place, but our feet and our hands are super intricate. So I definitely would encourage you to try some of these tips and see if there's a way that you can avoid surgery, especially on your feet for your bunions. All right, you guys ready? Here we go. So what can you do if you have bunion pain? The first thing you want to do is you want to be able to protect that bunion. So you're talking about a moleskin or the gel pads. You can get them at the drugstore or the grocery store. The reason why that is so important is because it helps to protect that bony formation that has occurred. That's what the bunion is. It's a bony formation at the base of your toe, big toe, usually. Some people get them on the base of their little toe too, but most of the time when people are come to see us about bunions, it's because it's on the base of the big toe. However, all these tips will work if it's on the little toe. So you're okay. You're still in a good place. So you want to protect it because what's going to happen is your body is going to respond to that abnormal force that's being put on that bony prominence by building up skin. So you're going to get a callus formation, which is going to make it harder to find shoes that fit correctly. So if you put a gel pad or a moleskin or something like that over it, it helps protect that so the body doesn't feel the need to produce that callus, which will make the bunion appear worse. Again, technically the bunion is the bony formation, so it doesn't actually get worse when there's skin formation on top of it, but the impact of it to your life gets worse. So just want to be clear on what we're talking about there. All right, for pain, definitely what you want to be using is ice. All right, ice is a super great pain inhibitor, which means it decreases your perception of the pain. And I know you may be like, I don't want to put ice on my feet. Listen, the research indicates that you only need to use ice for 3 to 5 minutes. I know, that can seem like a long time, especially when your feet are cold. Put a hot pack, close to your core so you feel nice and warm. Put a sweater on, something like that to keep yourself nice and warm. And then ice your bunion for 3 to 5 minutes. That's it. I promise once you're done with that, you'll get all the results of that pain inhibition. Your pain will go down. And again, I understand it's a Band-Aid technique. It's not going to last forever and it's not going to fix your bunion, but man, when you've got bunion pain, you just want something to get rid of it, right? So it will help. Just 3 to 5 minutes. Now, if you want to ice for longer than that, you're like, man, this feels good and I want to keep doing it. You want to do it for 20 minutes, that's fine. I'm just pointing out that the research indicates that 3 to 5 minutes gives you the most pain inhibitory techniques. All right, so 3 to 5 minutes, you can do it for 20, but you don't have to if you don't want to. All right, the other thing that is really, really helpful is to soak your feet in warm water. All right, not hot water, because that's going to be too much blood flow going into that area. But some warm water will help to decrease the muscle tension in the area surrounding the bunion, so in the rest of the foot. And sometimes getting that muscle tension decreased a little bit will help to take some stress off that bunion area. So put your feet in your bathtub or in a bucket or something like that of warm water. And then what I always recommend is people kind of wiggle their toes. So you kind of curl and you kind of straighten, you kind of try to get them to go apart and together. That helps to work the muscles a little bit more and gets them kind of stretched out a little bit. I know it's hard to stretch out your feet muscles, right? It is really hard. I understand that. But it can definitely be helpful in just getting those muscles moving around better, and definitely can decrease the pain of the bunion. The other thing that can work is taking some NSAIDs, some non-steroidal anti-inflammatory drugs. Again, I am a physical therapist, so I cannot actually recommend those. I can tell you that the research indicates that they're helpful. Now, my concern with those, especially long-term, is the effect on your gut and all that can happen with that. So I definitely recommend that you use them sparingly as needed for those really, really bad pain days. But we do want to take care of our gut. It's super important to protect that. So I definitely recommend with my patients only use something like that if you're having difficulty sleeping due to pain. Now, I'm just going to take a little side note here. If anything is keeping you from sleeping through the night, you need to deal with that issue. And if it's your bunion pain, you have got to deal with that issue. When you're sleeping is when your body's healing. It's when your brain is rejuvenating. There's a lot of research on what happens to our brains in the long term if we don't sleep regularly. So friends, it's very important to get good sleep. And if your bunion pain is keeping you from sleeping, it's very important that you do something about that. Now, for a lot of my patients, what I'll initially recommend while we're in the initial phases of treatment is that they use ice right before they go to bed, or if they're okay with it, even when they're in bed. I have some people who actually will fall asleep on ice. I know, I mean, then it's gonna make the bed kind of wettish, even if you use those gel packs, but hey, it works for them. I'm all for it, okay? But what you can do if you don't wanna have it in your bed is wrap your foot in that gel pad for 3 to 5 minutes when you lay down in bed, and then you can just chuck the gel pad over the side, go to sleep, and you can put it back in the freezer in the morning. That's usually what I recommend people do. But if you wanna fall asleep with it and it works for you, you do you, boo. All right. Now, can you stop the progression of bunion pain? Yes, you definitely can, and even stop the progression of bunions. Please, please, please hear me on this. I have successfully helped hundreds of patients stop the progression of their bunion formation and stop the pain from bunions. So please know that there are non-surgical techniques that can help you. All right. If you want to hear a story about one of our patients who we worked with, go listen to the other video that discusses what are bunions. I'm not going to go into that here, but we're going to talk about some tips of things you can do. The first thing is, did you know you can actually do foot exercises? Yes. There are actually foot exercises that have been proven to actually decrease the formation of bunions. They're not hard exercises, but they're kind of difficult. As you might imagine, trying to do exercises that are specifically for your feet are a little special form of challenging. So I'm not gonna go into them here because it really needs to be instructed in a one-on-one setting so that you're doing it right. However, know that there are exercises you can do, and they're actually researched and proven to stop bunions from progressing. The other thing you want to do is wear shoes that have a wide toe box. So, you know, your pointy stilettos, ladies, that's just not going to work, friends. I'm really sorry. I can't. I'm good, but I'm not that good. I cannot get you into pointy stilettos and not have progression of your bunion formation. All right. You want to make sure you have a nice wide toe box so your toes have enough room to wiggle around and be able to move. That will help to decrease stress on that metatarsal head so you get less bony formation. Along with that, you want to wear low-heeled shoes. So again, your pointy stilettos are putting a lot of stress right along that metatarsal head, which is what's causing that bony formation, which is what the bunion is. So we need to take the heels down ladies, I'm looking at you, and take that stress off that metatarsal head so it stops progressing. So lower heeled shoes, which I know may not be your favorites, and I'm sorry about that, but wide toe box, low heeled shoes definitely are helpful when you're talking about bunion formation. The other thing that can be helpful is using a shoe insert. So I usually recommend that people start with something that's over the counter. It can even be like a gel cushion. Not all people need an orthotic, but sometimes people need a little bit more support and cushioning. So everybody's foot is different, so I don't like to make a real general recommendation, but I definitely do recommend trying a gel insert or something that has a little bit of support. And that will help to decrease the stress on the metatarsal head, which will decrease the bunion formation. Now, if you find that an over-the-counter orthotic seems to really help for you and having that extra support really decreases your pain, then you might want to go see a podiatrist and get an actual custom orthotic made. I usually don't have people start with that though, because it's a big progression going from no support to a perfectly made orthotic support, and that can be a very difficult transition for our feet to make, especially if they're not getting any assistance from a manual physical therapist who's helping get the joints and the muscles and the ligaments and tendons all moving correctly, right? So I recommend that people start with something over the counter. If you find that that's helpful but you need more, then you go see the podiatrist and get a custom made orthotic. And my friends, decreasing weight will help to decrease the formation of bunion progression. So obviously the more weight we are holding and carrying around with us, the more weight we have going down through our feet. So if at all possible, taking some weight off can also be a helpful step in decreasing your bunion formation. All right, well, I hope that is super helpful for you. If you have questions on what manual physical therapy does specifically to treat bunion pain, or on the exercises that I discussed that will help with your bunion pain and to eliminate that from progressing any further, I definitely encourage you to give us a call. We'd love to have you come in for a free discovery visit, hear more about your story, and see if your goals are in alignment with what we offer here. All right, have a great day, everyone. Bye.